The reason we can be more successful than many other treatment facilities is that we have a very large focus on the dual diagnosis component of what goes along many times with addictions. And that has to do with some of the symptoms and the difficulties that they've suffered prior to the beginning of the addiction. These include anxiety, depression, trauma of various sorts, problems with suicidal thinking and attempts, PTSD, post-traumatic stress disorder after suffering a trauma, and many people suffer from problems that occurred during their childhood with attachment issues because parents were either negligent, not available to them, abusive emotionally, psychologically, or physically or sexually. And this creates a significant amount of impairment in these individuals. It creates for them, many of them, unbearable fear, anger, shame, diminished self-esteem, and problems with their relationships with other people. They can't regulate their emotions, and they can't do well in everyday life. This becomes an intolerable situation for life, and to seek relief is very normal in that situation. They seek relief through various addictions, alcohol and drugs, sometimes sexual addictions, shopping addictions, anything that takes them away from the acute pain of every day. So when these things happen to individuals, particularly earlier in life, those memories are stored traumatically. They're stored with all the emotions still there, and they continue to relive those situations again and again and get triggered by them. And unless there is a therapy that can deal with that, they'll continue to have those episodes in their life and be vulnerable to addiction. So one of the treatments, evidence-based treatment, that is very effective in dealing with traumatically stored material is called EMDR. It's eye movement desensitization and reprocessing. And what that does in a nutshell, the desensitization part is we take the emotion out of the event, out of the memory, so they're no longer reliving it as though it's occurring in the present. And secondly, it gets reprocessed. It actually gets moved to a part of the brain that stores memory as something that's beneficial to a human being to have experience that guides future actions rather than repeating the event. So eye movement desensitization and reprocessing is one of the treatment techniques that we utilize at Hawall Online Recovery to be able to make these changes. I think that saying we can fix all addictions is probably a bit of an exaggeration. We can, with the person being motivated for treatment, and if we have enough time to deal with the many times the trauma and the other psychological issues that they bring into a treatment program with their addiction, we can be successful then almost all the time. But those factors aren't always met. Our present success rate, and the way we measure it, is we look for 1 year after treatment that the individual is still clean and sober, that they're free of relapse. And our percentage right now is over 80%.